Hey guys, so I had made a couple of the other physical therapy videos and I was on a roll with it, so I decided to make a video of my story with thoracic outlet syndrome. And my story is sad, pretty, I've had spent the last 15 years in the most unimaginable pain. Um, Unfortunately, my story is not unique at all for somebody with thoracic outlet syndrome. In fact, it's the norm, um, not the exception. So I don't know where to begin. So I'm 37 years old right now. I probably had my earliest noticeable symptoms of thoracic outlet syndrome in my early 20s, possibly earlier in my teens, but it really became a problem in my mid-20s. I was a competitive swimmer for years, which it can be, it can be more common in swimming due to all the repetitive upper body stuff. And the strength training and the hours and hours of swimming. And I was a breaststroker, so I was constantly shrugging my shoulders up. I kind of hunched over posture, which is all not real great for thoracic outlet syndrome. But it did, I swam all through high school and through college. I went to the University of Pittsburgh on swimming scholarship. So and then after that, after I graduated, then I started to have, a few years later, started to have like a lot of neck pain and like pain up in here. By my mid-20s, I had a job. I was driving a ton too. And the driving posture was really flaring things up. And by that point, I started to have extremely severe symptoms. And I have pretty much one of the craziest pain tolerances imaginable. Like, I just have one of the highest pain tolerances ever. Like, a couple years ago, I ran a full marathon on a stress fracture in my femur, and there were like 3 stress fractures in my left tibia. And I was just like, oh, my leg hurt a little bit. It's just, I guess I'm just so used to being in pain that, I don't know. So by my mid-20s, I was in constant pain. My neck was stiff. I could like barely, if I was going to turn, I'd have to turn my whole body to the side. I couldn't just turn from left to right. And the pain started to radiate down my arms, into my hands, mostly in the first 3 fingers. And it was completely bilateral, and it was like my whole hands hurt so bad. I had a tremor all the time. Like, my hand was just like shaking all the time. So by then I was like, oh, I must have really bad carpal tunnel. Better go get that checked out. And I went and got it checked out, and the EMG was, it didn't show any nerve compression. So they weren't then sure if it was carpal tunnel. And then from there began what we call like the TOS shuffle, where I was just, test after test and going from specialist to specialist. And, nothing was checking out. I was telling them, I knew what thoracic outlet syndrome was because my mother actually has it. And I would tell them that that's what I knew I had, because there's not that many other things. There's only a handful of other conditions that have like identical symptoms. And because the discs in my neck were okay, but either, oh no, you don't have that, or they would just look at me blankly. I ended up having carpal tunnel release, which helped a little bit. It probably, you know, opened up some of the compression in my hand. But, you know, I was still in the most unimaginable pain ever. And I couldn't, you know, it was the classic symptoms. I couldn't do anything overhead was like provoking massive symptoms. At that point, I was about, you know, 26, and I had just bought my first house. You know, I was all proud of myself for buying my own house, and I was doing a lot of the yard work and everything. I have a close to an acre property, and a lot of it's uphill. And I used to mow the grass. I used to push the lawnmower uphill. I used to do everything around here. And then my hands got so bad I couldn't do anything anymore. Like I could no longer cut the grass. It was impossible to like get through all my, like if I got a bunch of mail, like my mail would just pile up because opening it was like awful. So then I would like avoid it because it hurt so bad. Doing the dishes was terrible. Doing my laundry, oh my God, it was awful. You know, there were so many little modifications now looking back that I did to kind of get around my horrible symptoms. Like if I did a load of laundry, I'd do the laundry and then I would just kind of leave most of it in the dryer, and then, you know, in the morning I'd go downstairs, turn on the dryer, so get the wrinkles out, and then pick out what I was going to wear instead of folding it and hanging it up, because my hands would just, you know, they'd hurt so bad, and then they would be like seizing up and cramping up, and then they'd be out of commission for like, you know, pretty much hours at least, or even the rest of the day. So, you know, the things that most people take for granted, I could not do at all. I also began like losing dexterity in my hands. I was dropping everything, like, you know, keeping up with household stuff was really hard. And then when I would do it, then I would drop stuff and like just make things even worse, and then I'd end up I would try and clean, and then I would make a mess while cleaning, and it was just so frustrating. It was so like, I didn't know what was happening to me, and it was just so humiliating. You know, I don't know how I got by for years. I just don't know how. Probably because I have a very high pain tolerance, probably because I had no other choice. You know, I have to work. I have a mortgage, I have bills. I pretty much was doing most things, like, because I couldn't do anything overhead and I couldn't reach up, I pretty much would do most things with, like, my arm, like, kind of locked by my side. That was the position that I could, you know, was able to do some things. So, you know, all the difficulties with that pretty much has led to breakdowns of, like, most relationships I've ever been in, because it's just, I guess, too incredibly frustrating for somebody to have to deal with somebody like me that, you know, looks completely normal, looks like there's nothing wrong, you know, can exercise, can run, you know, I train for marathons and everything. I can run a marathon, but I couldn't do my own laundry. I couldn't do the dishes. You know, it made no sense. So eventually they decided that since they couldn't find anything wrong with me, and that my nerves were fine because my nerve conduction studies were normal, which now I know is more, you know, that rarely does a nerve conduction study show with thoracic outlet syndrome, unless there's actual nerve damage, which is not very common. So eventually somebody, you know, I got diagnosed with fibromyalgia and was put on Lyrica, which blocks nerve pain, which they said, it's not your nerves are fine. Then they give me a nerve pain blocker, which actually led to like enormous symptom relief, and I was able to function again. still in pain, but it was reduced. It was reduced by like 30% or something, which is huge for somebody that was in pain for the greater part of 10 to 15 years at like, and probably, I would say at minimum, like 7 out of 10, 7 to 8 out of 10. And on my worst days, it was 9 to 10 out of 10, like severe, unimaginable pain. So I figured I didn't have fibromyalgia, but the medication was working. But then at that point, stopped trying to, that's when, it was like, okay, there was no further investigation. And I was kind of hesitant to take a medicine that would block nerve pain if I wasn't sure what was going on and if there would be nerve damage or not. But it did help. About 5 to 6 years later, the TOS thing got revisited again. I actually had a couple of physical therapists who I brought it up again, and they were like, they informally diagnosed me with it, and they did some stuff that helped a bit, as long as it wasn't any of the strengthening stuff, because typically people with thoracic outlet syndrome, when they try and strengthen, it doesn't work, because the scalenes are so tight, the rib is so screwed up, there's so much compression that if you try and strengthen, or even if you try and stretch, like if you try and stretch in this position or that position, when you have that level of compression going on, like it can make things a lot worse, and it usually does for most patients that are severe. So they had recommended to go and get diagnosed by a neurologist, but at that point I knew what thoracic outlet syndrome was, but I had a lot of misinformation about what the treatment and the surgery was. I had heard that the surgery was like multiple incisions, and they take out like your rib and your collarbone, and they fillet you like a fish, and that it's only 50% effective. None of that is, I hope they never have done surgery like that on anybody. But so I figured, well, I'm never going to do that, so there's obviously no treatment for it. So I didn't really pursue it further. Plus, after what I had been through, I'm like, what's the difference? So fast forward a couple more years after that, until actually this year, I started having migraines, which I actually never had migraines before. It was like the one condition I've never had, and so my family doctor referred me to a neurologist. And when I went there, she began questioning my fibromyalgia diagnosis, which actually did not make me mad, because I knew that's not what the problem was. And I said it was thoracic outlet, and she said, oh, thoracic outlet, that's very rare. I'm sure you don't have that. And she began examining me, and I must have been losing my pulse like crazy or something with my arms overhead, because she dropped her arm she dropped my arm, ran to the computer, and was like, it's not your nerves for sure, it's your arteries, there's no blood flow, we have to, and she ordered some ultrasound and x-rays and stuff, but it actually was my nerves. I do have neurogenic thoracic outlet syndrome, but it had gotten so bad that I had real severe compression of not only my nerves, but my veins and arteries as well, which, some TOS specialists will call that the arterial types or the venous types, and others, don't diagnose that until like you've actually have a blood clot or an aneurysm. So at that point, my condition had completely deteriorated to the point that I was pretty much unable to do anything. And my hands were ice cold all the time in the winter. The vascular symptoms were really bad. If I raised my hand even this much, boom, the blood would just drain out of it, and my hand would go cold and white. My handwriting in the span of 2 months had deteriorated into like, I couldn't even read my own handwriting, and I could always read my own terrible handwriting. And my hand, it was just like a claw, and I would get like all this tremors, and I get like these twitches like this. I was in so much pain I couldn't sleep. I was up all night. And then I started to get like rashes and flushing, and then I would get swelling, and then the swelling would go away, and I was like getting real scared, And then the other really, really scary symptom that I was having was my neck was like basically, it would get so huge here that it was like strangling me. it was like so much compression here that I couldn't get air in. And I would have like, I guess, I thought they were panic attacks, but I guess anybody would have a panic attack if they were getting strangled. So my neck would just start choking me. Like my neck was putting me in a chokehold. And then the scariest thing that started happening to me is if I turn my head like this way or that way far, not even that far, but if I just turn it this way and that way, I would get dizzy. And if I turn it far enough, I would lose my vision and pass out. And that happened multiple times. And it was really scary. Leading up to surgery, at that point I wasn't sure where I was getting surgery, but I knew I needed it, so I was on the hunt to find a surgeon fast. It had gotten so bad, I could no longer go into my cabinet, get a glass, go to the sink, reach over, and like, you know, I kind of have to hold it like this, and hold it while I filled it. I could hold it for maybe that much water, and then I couldn't hold it anymore. It would either drop out of my hands, or like I would have to like take like 10 breaks just to get one glass of water. It's just ridiculous. Like, I love cooking. In about January or February before my surgery, I stopped being able to cook completely. I couldn't even cook, and I really loved cooking. I couldn't clean like at all. I just couldn't even do anything. I was having trouble dressing myself. I was having trouble showering. It was very hard to wash my hair, shave my armpits because like my arm had to be up. I pretty much couldn't even pick up a shirt, put it on a clothes hanger, and then hang it in the closet without like having to stop and like stretch my arm out, and 5 minutes later I could do another shirt. So that's not right. You know. I had to switch to all paper plates and plasticware. You know, I couldn't, it was hard to comb my hair, so I would have to comb my hair like this. I couldn't, you know, I would always braid my hair when I would run because my hair is so long. I couldn't do that anymore. It was awful. It was it was so bad. It was, you know, at one time I decided to go grocery shopping on my own, and I had done like a lot of reaching up, and I got home and I couldn't get the groceries out of my car, and I had to call somebody to help, which was, you know, it's like otherwise the groceries would have just sat in my car and everything I bought would have just gone bad. So I had then, so going into surgery, I was on the hunt for a surgeon, and I decided I was going to get my surgery done at Johns Hopkins University with Dr. Yingwei Lum. And Dr. Lum, I mean, Dr. Lum is the doctor that has changed my life forever. They're so excellent there. The whole process from confirming your diagnosis right through to surgery, and even, you know, after surgery has been so seamless, and they're so amazing about communication. It's so easy to get in touch with everybody, and they also have a very wonderful physician's assistant, Holly. She's so great. She's so caring. So, you know, I think it was about April, that's when it was like, we're getting surgery. Had my surgery scheduled June 1st, and then I was having the second one done about 8 weeks later. So, you know, going into surgery, there was lots of preparation. I had to basically pay people to rearrange my house, take all my clothes out of my closets and put them on like waist-high garment racks. I had to have everybody take things out of my cabinets and put them like on the countertops. I had to switch to, you know, and I had already switched to like paper plates, plastic cups, everything. We'd go to Trader Joe's like and just get all these bagged frozen meals, and that's what I ate for months, or otherwise, you know, what else was I gonna do? You know, my friends and family were like freaking out pretty much. Going into surgery. I was not. I knew how good my surgeon was. I knew, how successful his surgical outcomes were. I'd read tons of the research that came out of Johns Hopkins University. So, I was really confident that I was going to do fine there. But one of the saddest things I remember telling someone was like, "Don't worry, there's nothing to be worried about. It's going to be fine. You know, this, it's going to be fine. I'm going to have my life back after this." And then I remember saying, like, "But if something happens to me on the operating table, and if I were to die in surgery, then at least I would be out of pain, and then I would be happy." That is not any way to live. To be happy either with a successful surgical outcome or dying. So, anyways, I figured that won't actually happen, but, my surgery went great. The surgery is absolutely brutal. The recovery is brutal. But I didn't care, I didn't care, It was, I had to do it. So I had both sides done. Right now, I'm almost completely out of pain, which I never in my life thought that I would be almost 100% pain-free. I have tons of flexibility. Like, before, like I said before, I had to go like this, to turn my head. And now, turn my head like this. I can look up. I can arms overhead. Pretty much the only thing that really still bugs me is my hands don't hurt anymore, but they're just very weak because they're so atrophied from how severe and how long my symptoms were and how long it was that I was unable to use them properly. So they're coming along. So that's been pretty much the only slow going thing. But they're getting better. So, everything's great. I can function again. I feel like a person. And, my friends always tease me because I'm always talking about how awesome and how amazing my surgeon is. But, like, I will never be able to thank him enough because now I have my life back. Which, like I said, I didn't think would be possible. And I will be forever grateful. The recovery, it's been a process. It's my last surgery, my second surgery was on July 27th, and now it's January now. I've been working really hard at PT. I have a really amazing physical therapist. His name is Perry Tallman. He's local at Wellspan in York, Pennsylvania. He's a manual physical therapist, which makes all the difference in the world. And he actually knows what thoracic outlet syndrome is. He knows a lot about it. He knows how to deal with people who have it. He knows that you can't rush to strengthen without the range of motion. He has just been so instrumental too in my recovery. I fired I don't know how many physical therapists before Perry. I wish I had met him years ago before it got so severe. So again, I'm feeling great. I have my life back. Even little things that we take for granted that I can now do. The other day, I wrote. I was at work and I was busy. I got wrapped up and I was writing something. I wrote for 2 hours, and after 2 hours, I was like, "Geez, I got to stretch my hand." I couldn't even do that for like 2 minutes before surgery. Just even like sometimes I just reach up for something and I can't believe that I can just reach up and grab something and get something now. It's amazing. So, I kind of just made this video is now 25 minutes long, so sorry about the length, but I just wanted, to kind of share my story. Um, there's hope, for people with this condition if they have the right resources, the right support. My the Facebook group that I belong to, it, you know, I had the most amazing support there. Um, you know, with that there is good treatment available, but you have to become an expert in it. And you have to become an expert in thoracic outlet. And trust me, you will become you know, I think that pretty much most of us are almost experts in it and know so much more about thoracic outlet syndrome than probably, I don't know, 99% of doctors out there. And that is sad. You know, that is sad. Um, that so many doctors and even specialists either don't know about it, don't want to know about it, or don't believe in thoracic outlet syndrome. And that is horrible. But don't get discouraged. You have to be a strong advocate for yourself. But, after what happened to me, I just thought it was such an outrage what happened to me. And then, after my diagnosis, when I joined, the Facebook support group for thoracic outlet syndrome, and I found out that what happened to me was the norm for people with thoracic outlet syndrome. That pretty much it was very, very rare for somebody to have it and then become diagnosed and treated in like 2 years. For most of us, it drags on for years and years. Where we get told, you get accused of drug seeking, you get accused of faking, you get accused of having a low pain tolerance, you get told to, I had one doctor who was particularly horrifying. He told me there was absolutely nothing wrong with my neck. He said that I should take Advil gel caps and that I should go see a psychiatrist or a neurologist, maybe. Well, I did go see a psychiatrist who was just appalled and was like, how could somebody treat a patient like that? So, it shouldn't be happening to us, but hopefully in the future things will get better for everybody with thoracic outlet syndrome. After what happened to me, I decided that I was going to do whatever I could do to help anybody with it so that what happened to me didn't continue to happen to other people in the future. So anyways, that's my story. So hopefully it's helpful to some people. So yeah.